Have you ever wondered how your choice of nuts can affect your health after 65? Surprisingly, some of them can do more harm than good, increasing the risk of heart disease by as much as 48%. This isn't just speculation, it's data backed by scientific research. According to a study published in the Journal of the American College of Cardiology, certain types of nuts can trigger inflammation, raise blood pressure, and even worsen memory problems. Imagine that the most common nuts, the ones many people eat daily, could actually be the most dangerous. One such nut, often considered healthy, contains a toxic compound that can gradually harm the liver, kidneys, and even the brain. And most alarmingly, it's probably already in your pantry, being a popular component of low-carb diets. However, for people over 65, eating it can lead to serious problems. But which nuts should you eat, and which should you avoid? You'll find the answers to these questions below. Don't worry, you'll be fully supported. This video will detail the types of nuts that older adults simply must include in their diets to maintain cardiovascular health, stimulate brain activity, and strengthen bone tissue. In addition, it will debunk myths about nuts that should be avoided, as they can subtly harm health, even if a person is unaware of it. By watching to the end, everyone will learn the truth about which nut is strictly not recommended for consumption, something most people don't even mention. In fourth place on the list of healthy nuts is almonds. As you age, maintaining bone strength becomes paramount, and that's where almonds come in. These small but mighty sources of nutrients contain calcium and vitamin E, two elements that play a key role in maintaining bone health. In fact, eating just a small serving of almonds, about 1 cup a day, provides the body with approximately 97 milligrams of calcium. At first glance, this may seem like a negligible amount, but it's enough to slow down the process of bone loss, which naturally accelerates with age. After 65, the risk of fractures increases significantly, so strengthening bones becomes one of the most important tasks for maintaining health. Almonds are not only a storehouse of calcium, but also a valuable source of magnesium, an element that is often deficient in older adults. Magnesium plays a key role in transporting calcium directly to bone tissue, ensuring its strength and health. In addition, it prevents the deposition of calcium in the arteries, which is an important factor in the prevention of cardiovascular disease, especially important for older adults. However, the beneficial effects of almonds on the body are not limited to this. They are rich in monounsaturated fats, which help lower levels of bad LDL cholesterol, which is crucial for maintaining heart health as you age. Thus, a small handful of almonds daily not only strengthens bones, but also takes care of the health of the cardiovascular system. Don't forget about the high fiber content in almonds, about 3.5 grams per serving. Fiber helps normalize digestion, which is especially important for older adults, as constipation often becomes a common problem at this age. In addition, studies conducted at Tufts University have shown that almonds have neuroprotective properties, protecting the brain from oxidative stress, one of the main factors contributing to age-related cognitive decline. Regular consumption of almonds can help maintain the health of brain cells and reduce the risk of developing memory problems in the future. To feel a boost of energy and vigor, experts recommend eating almonds that have not been peeled. It turns out that it is in the skin that there is a storehouse of flavonoids, valuable plant pigments that, in tandem with vitamin E, multiply the antioxidant properties of this nut. However, it is worth considering that almonds can be difficult to chew, especially for people with dental problems or difficulty swallowing. But don't despair, because there is a great alternative: ground almonds or almond butter, provided it does not contain added sugar. These forms of the product retain all the wonderful properties of the whole nut, allowing you to fully enjoy its benefits for strengthening bones and the cardiovascular system. It's important to understand that almonds are not just a pleasant treat, but a valuable product capable of providing significant support to the body during aging, protecting it from negative environmental influences. Second on the list of beneficial nuts are walnuts, recognized as one of the best for maintaining brain health. And it's not just their striking resemblance to this vital organ. Walnuts are rich in plant-based omega-3 fatty acids, known as ALA, which play a key role in maintaining an effective brain communication system, ensuring the flexibility and health of brain cell membranes. This is especially important in old age when it's necessary to maintain strong neural connections to preserve cognitive functions. The Journal of Nutrition published the results of a study that showed the beneficial effects of walnuts on the cognitive functions of older adults. In particular, those who consumed about 42 grams of these nuts daily for 8 weeks showed an increase in brain information processing speed and improved mental flexibility. In other words, regular consumption of walnuts can maintain mental clarity even in old age. This beneficial effect of walnuts is due to the high content of polyphenols, powerful plant compounds that can penetrate the blood-brain barrier and have an anti-inflammatory effect directly in the brain. This mechanism may play an important role in slowing the development of neurodegenerative diseases such as Alzheimer's and dementia. In addition, walnuts are a source of melatonin, a hormone that regulates sleep. With age, the body's natural production of melatonin decreases, so eating a small portion of walnuts before bed can help improve sleep quality. In addition to the benefits for the brain, walnuts have a positive effect on the cardiovascular system. They contain arginine, an amino acid that improves blood vessel function, and polyphenols that reduce oxidative stress. The combination of these factors helps lower blood pressure and improve overall heart health. Notably, walnuts can increase the effectiveness of medications, which is especially important for older people who face various health problems and are forced to take medications. To extend the shelf life of walnuts and preserve their delicious taste, it is recommended to store them in a cool place, such as a refrigerator. Left at room temperature, these valuable nuts can quickly lose their quality and acquire an unpleasant rancid taste. Eating a small amount of walnuts daily, about 7 to 9 halves, is optimal for maintaining health. The process of cracking nuts yourself can be an excellent workout for the hands, promoting the development of fine motor skills and dexterity. Don't be put off by the slightly bitter taste of walnuts, because it is this bitterness that indicates a high content of powerful antioxidants, which play an important role in protecting the body from harmful effects. Pistachios, perhaps undeservedly, remain in the shadow of other nuts, especially when it comes to maintaining heart health, particularly in older adults. These small green treasures of nature are low in sodium and high in potassium, about 285 mg per serving. This combination of minerals helps remove excess salt from the body through the kidneys, which is especially important with age when the body tends to retain more sodium. Pistachios help balance this process, making them a valuable addition to the diet of older adults. The beneficial properties of pistachios are not limited to this. Studies have shown that eating just a small handful of these nuts daily can reduce systolic blood pressure by 3 to 5 points. This effect is comparable to some medications designed to lower blood pressure, but without any side effects. For older adults, maintaining healthy blood pressure is one of the most important factors in overall health, and pistachios are a simple and delicious way to keep it normal. Pistachios shine when it comes to maintaining eye health. These gifts of nature are generously endowed with lutein and zeaxanthin, two powerful antioxidants that protect the visual system, protecting it from age-related macular degeneration, AMD, the main cause of vision loss in people over 60. Thus, by eating pistachios, a person not only takes care of their heart health, but also contributes to maintaining visual acuity, which is especially important over time. It is also worth noting the delicacy of shatis. Pistachios in relation to teeth and gums. For those who experience discomfort when eating hard nuts, the soft texture of pistachios will be a real discovery. Moreover, the process of shelling pistachios slows down the rate of consumption, contributing to a more mindful approach to the amount eaten. The accumulating pile of empty shells serves as a clear signal of satiety, helping to avoid overeating. For elderly people suffering from arthritis or those who find it difficult to crack nuts, there is a simple solution: purchasing pistachios that are already partially shelled, which greatly facilitates the process of eating them. Nutritionists recommend consuming about 49 pistachios a day, which is equivalent to approximately 30 grams. At the same time, preference should be given to unsalted or lightly salted varieties to avoid excessive sodium intake. Considering all the above advantages, it is not surprising that pistachios have earned a reputation as a heart-healthy treat that is recommended for inclusion in the daily diet of the elderly. At the top of the list of healthy foods for the elderly are Brazil nuts, often undeservedly overlooked, but possessing impressive potential for maintaining health. One of the most notable properties of these nuts is their beneficial effect on the thyroid gland, a small but vital organ responsible for regulating energy metabolism, and mood. With age, the functionality of the thyroid gland often deteriorates, which can manifest as fatigue, weight gain, or a depressed state. Surprisingly, just one Brazil nut can provide the body with a daily dose of selenium, an element that plays a key role in maintaining healthy thyroid function. However, the benefits of Brazil nuts are not limited to this. Selenium is also actively involved in protecting nerve cells, which is especially important for maintaining cognitive function in old age. Maintaining clarity of mind is a priority task, and selenium found in Brazil nuts can be a reliable aid in this struggle, reducing oxidative stress and inflammatory processes in the brain, making these nuts a valuable ally in the prevention of age-related cognitive decline. Brazil nuts, rich in healthy fats, have a beneficial effect on the cardiovascular system. The fiber also contained in these nuts promotes normal digestion, making them a valuable addition to the diet of elderly people who care about maintaining their health. However, given the high content of selenium in Brazil nuts, it is necessary to observe moderation in their consumption. Exceeding the recommended dose can lead to selenium toxicity, causing various undesirable reactions in the body. Experts recommend limiting yourself to 1 or 2 nuts a day to get the maximum benefit without the risk of overdose. Thus, moderate consumption of Brazil nuts can be a simple and effective way to support health, especially the function of the thyroid gland and brain. Having considered the beneficial properties of nuts, it is worth paying attention to those types whose consumption should be limited. In 4th place on this list is peanuts. Despite its popularity, peanuts can pose a certain danger to the health of the elderly. It is important to note that peanuts, contrary to popular belief, belong to the legume family and have a number of features that distinguish them from real nuts. Peanuts, so beloved by many, harbor a number of threats, especially for older people. The main danger lies in the susceptibility of peanuts to contamination with aflatoxins, poisonous compounds that produce mold fungi. Excessive consumption of these toxins is fraught with serious consequences for the liver and a significant increase in the risk of developing oncological diseases. Over the course of life, the body's ability to neutralize harmful substances weakens, which makes older people particularly susceptible to the negative effects of aflatoxins. In addition to potential mold contamination, peanuts are characterized by a high content of omega-6 fatty acids. Although in moderate doses omega-6 is necessary for the normal functioning of the body, their excess can provoke inflammatory processes. For older people, this can result in exacerbation of diseases such as arthritis, joint pain, and other inflammatory ailments. With age, the problem of inflammation becomes increasingly relevant, and excessive consumption of peanuts can only exacerbate these problems. It should not be forgotten that peanuts are often an ingredient in various processed snacks, which implies the presence of added sugar, harmful oils, and excessive amounts of salt in their composition. All these additives can negatively affect heart health, increase blood pressure, and lead to weight gain, which is especially important for older people to consider. The combination of unhealthy fats, excess salt, and sugar makes peanuts a less than ideal choice for seniors looking to maintain a healthy lifestyle. Despite their widespread popularity and seemingly harmless nature, peanuts can pose a hidden threat, especially for older adults. Aflatoxin contamination, an excess of omega-6 fatty acids, and harmful additives often found in peanut-containing products make this nut an undesirable guest on the table of an elderly person. Of course, occasional peanut consumption is unlikely to cause harm, but regular intake is not recommended, especially if you are concerned about your health in your later years. Cashews are third on the list of undesirable foods for the elderly. These nuts, which seem like a harmless snack, harbor hidden risks, primarily related to blood sugar levels. Despite the popular belief that cashews are good for the heart, their high carbohydrate content can trigger rapid spikes in blood glucose levels. This is especially dangerous for the quarter of older adults who have diabetes or prediabetes. In addition, cashews have a high glycemic index, meaning that blood sugar levels rise rapidly after consumption. For those who are trying to control their blood glucose levels, this can be a serious problem. However, the list of potential problems associated with cashew consumption does not end there. These nuts contain a significant amount of oxalates, substances that can interfere with calcium absorption, which is especially critical for older people who are trying to maintain strong bones. Moreover, oxalates can promote the formation of kidney stones, the risk of which also increases with age. Older people are already more prone to kidney stones, and excessive consumption of cashews can further exacerbate this problem. In addition to all of this, many cashews on the market are processed with oils and salt, which significantly reduces their health benefits. These added fats and sodium can raise bad cholesterol levels, blood pressure, and put extra stress on the cardiovascular system. For people of age, maintaining heart health is a priority, and eating cashews with harmful additives can negate efforts to strengthen the heart muscle. Cashews, while delicious and nutritious, require careful consideration from older adults regarding health aspects such as blood sugar levels, kidney function, and the cardiovascular system. People with diabetes who are at risk for kidney stones or who are watching their sodium intake should exercise moderation in their consumption of cashews or consider alternative, healthier nuts. An occasional small serving is not dangerous, but daily inclusion of cashews in the diet is not recommended for older adults seeking to maintain good health. Macadamia nuts take second place on the list, which, despite their exquisite taste, can pose a certain danger to older people. Characterized by high calorie and saturated fat content, these nuts can be a problem for older adults, especially those who are trying to control their weight. Even a small serving of macadamia nuts can significantly increase the calorie content of the diet, contributing to weight gain with frequent consumption. Maintaining a healthy weight plays a key role in managing various conditions such as diabetes, cardiovascular disease, and joint pain, making moderate consumption of macadamia nuts especially important for older people. Excessive enthusiasm for macadamia hides certain health risks for older adults. The high fat content of these nuts can negatively affect cholesterol levels, increasing the concentration of low-density lipoproteins, LDLs, known as bad cholesterol. This, in turn, is a significant factor in the development of cardiovascular disease, the risk of which is already increased in old age. But it's not just about the calorie and fat content of macadamia. These nuts have a dense and firm texture, which can be a problem for people with weakened teeth or oral problems. For those who have difficulty chewing or who wear dentures, eating macadamia can cause discomfort and even pain. It is important to remember that the load on the teeth, which seems insignificant in youth, can have a more significant impact on health with age, and it is not worth taking risks in this case. Another potential danger associated with macadamia is its ability to provoke problems in people with gallstones. Excessive consumption of these high-fat nuts, especially in large quantities, can cause gallbladder discomfort and lead to painful attacks in people prone to gallstone formation. Given the high fat content of macadamia nuts, older adults should exercise caution and limit their consumption to avoid such complications. Despite their delicious taste, macadamia nuts can be an overly rich food for older individuals, both in terms of calories and fat content. In cases where weight management, cardiovascular health, or dental issues are a concern, it is recommended to avoid these nuts or minimize their consumption. There are many other types of nuts that have more favorable health properties and do not carry potential risks. Therefore, if the desire arises, one can occasionally indulge in macadamia nuts, but they should not be included in the daily diet, especially if the goal is to maintain optimal body condition over time. Particular attention should be paid to pine nuts. At first glance, they may seem like a harmless and pleasant snack, but they conceal certain risks, especially for older adults. One of the most serious problems associated with pine nuts is their interaction with medications. Many older people take prescription drugs to maintain their health, but substances contained in pine nuts can react with more than 60% of common medications, reducing their effectiveness or causing undesirable side effects. This can pose a serious danger as it can affect the body's response to important treatments, making it difficult to maintain health and control chronic diseases. Pine nuts, in addition to their potential interaction with certain medications, are also associated with a phenomenon known as pine nut syndrome. This syndrome is characterized by the appearance of a persistent bitter or metallic taste in the mouth, which can last for several weeks after consuming the nuts. In older people, this condition can cause particular concern, as it often leads to a decrease in appetite. Such a decrease in interest in food can ultimately lead to undesirable weight loss, which is especially critical for older adults who are already at risk of malnutrition. Maintaining a healthy weight is crucial for supporting the immune system and overall well-being of older adults, so loss of appetite due to a persistent unpleasant taste can create serious health problems. Another aspect associated with pine nut consumption is their high content of polyunsaturated fats. Although fats are an important component of a balanced diet, the polyunsaturated fats in pine nuts are prone to rapid oxidation. This process can contribute to increased inflammation in the body. For older adults, this can exacerbate existing conditions such as arthritis, increasing joint pain, and stiffness. Thus, if a person is already dealing with inflammatory processes, adding pine nuts to the diet may actually worsen the situation rather than improve it. Despite the appeal of pine nuts as a healthy snack, their consumption can pose certain health risks for older adults. There is a possibility of negative interaction with medications, suppression of appetite, and the provocation of inflammatory processes in the body. In this regard, older adults should carefully weigh the pros and cons before including pine nuts in their diet. It may be advisable to avoid them altogether or consult a doctor, especially if the patient is taking any medications. Health should be a priority, so it is necessary to carefully consider the choice of food, preferring those that bring benefit rather than harm. People over 65 years of age should be especially careful when choosing nuts, as this can have a significant impact on various aspects of health, including energy levels, cognitive function, sleep quality, digestion, bone health, and overall well-being in the long term. It is a common belief that all nuts are healthy, but there are many nuances in this matter that become especially relevant with age. The type of nuts, the quantity, and the method of their processing can play an important role in maintaining the health and well-being of older adults. Minor adjustments to your nut intake, such as replacing peanuts with more nutritious almonds or moderately reducing your consumption of cashews, can significantly impact your energy levels, emotional state, and overall physical well-being. The key here is making conscious food choices that promote health rather than triggering adverse reactions in the body. The author asks readers, have you ever noticed how including or excluding certain types of nuts from your diet affects your health? Perhaps a particular type of nut gave you energy and strength, while another, on the contrary, caused stomach discomfort. The author encourages you to share your observations and tell us how different nuts affect your well-being by leaving comments below. He is extremely interested in your personal experience and how these gifts of nature are reflected in your body.